Hello, 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 everyone. Welcome to another episode of Sree's Daily Global COVID-19 Show. Today is episode number 250. That's right, we've been live for more than 200 days, 250 days in a row during the pandemic, during the lockdown in New York. And because it's an epic milestone episode, we have epic milestone guests. We're going to be joined in just a moment by Dr. Peter Hotez, vaccine scientist, pediatrician, author of Preventing the Next Pandemic. He's at Peter Hotez. Please check him out. We're also going to be joined later by Sunny Slaughter, executive consultant and expert on diversity, equity, and inclusion. She's at Sunny_Slaughter. We are so thrilled to have you all with us. Please hit share right now. Dr. Hotez is also the founding dean of the National School of Tropical Medicine and professor of pediatrics and molecular virology and microbiology at the Baylor College of Medicine, where he's also the director of Texas Children's Hospital Center for Vaccine Development and the Texas Children's Hospital Endowed Chair in Tropical Pediatrics. You will meet him in just a moment. Hi, everyone. I'm Sree. Thank you all for being here. We're live right now on Facebook, on Twitter, on YouTube, and on LinkedIn. We are so grateful to you. My name is Sree Sreenivasan. I'm the Marshall Loeb Visiting Professor of Digital Innovation at Stony Brook School of Journalism and the co-founder of Digimentors, a social, digital, and virtual events consulting company. We ask you all, if you're working on virtual events, to contact us. We've done events for 50 people and 100,000 people. We bet your event is somewhere between those two numbers. As you can see, in our first 240 episodes, we've had more than 1 million viewers, more than 440 guests from 72 cities and 20 countries. Our archives are at youtube.com/Sreenet. We are so grateful to our partners at Scroll Global and Scroll.in. Our producers are Rose Horowitz at Rose Horowitz 31 and Vandana Menon, Vandana_Menon. They'll be joining the show later on to share their favorite memories of doing this daily show. All right, are you ready to meet Dr. Hotez? I am. There's so much for us to learn from him. He is joining us after being on CNN, MSNBC, Fox, and BBC, and he still has more to do tonight. We are so grateful to him for being here. Let's say hello. Hi, doctor.
Hello, how are you?
I'm surprised you're able to be upright right now, considering how hard you're working on a Sunday.
Yeah, and all the media stuff is not even my day job. We're trying to accelerate a vaccine, a low-cost COVID-19 vaccine. We're now making 1 billion doses through our excellent collaborators in Hyderabad, India, known as BioE or Biological E, amazing industry producers of vaccines. They're one of the largest producers of vaccine in India and the world, and they're working day and night to get a low-cost vaccine out to the people who need them, especially for the world's low and middle income countries, places like India, but across Asia, into Africa and Latin America.
So when will there be news for all of us to hear?
Well, we're hoping to make an announcement tomorrow about beginning clinical trials in multiple sites across India, and then trying to work out a pathway by which we can provide vaccine for the world. You know, one of the problems is, the Pfizer vaccine, Moderna vaccine are looking like great vaccines, but they're brand new technology that's never been scaled before. And that's issue number one. So we don't know about the durability of protection. I think we have a pretty good firm handle on the safety because these are big 30 to 40,000 person clinical trials. But then the other problem is, for instance, the Pfizer vaccine requires frozen storage at -94 degrees Fahrenheit. And how do you do that deep freeze in the poorest countries in sub-Saharan Africa or even Latin America and Asia? And so if you can come through with an additional belts and suspenders in terms of low-cost vaccines, that would be great. That could be refrigerated, and that's what ours does. You can store it at 4 degrees, which is pretty typical, 4 degrees Celsius, which is refrigerator temperature for, which is what we do for most vaccines. And we think, it uses the same technology that's used to make the recombinant hepatitis B vaccine. And the reason that's relevant is recombinant hepatitis B vaccine is made locally in Brazil and Cuba and India and Indonesia, and Bangladesh, and several other places, so that by having a vaccine that uses that same technology that's 40 years old and a well-known safety record, I think it can and really help and make a contribution to this pandemic. And as I mentioned, BioE is producing 1.2 billion doses. So I'm so excited about this. We develop low-cost global health vaccines for the world, vaccines for disease targets that no one else will touch, because there's no financial model for it. There's no financial remuneration. So we make parasitic disease vaccines for diseases such as leishmaniasis and Chagas disease and schistosomiasis. I call them the most important diseases you've never heard of. Hookworm infection, river blindness with our colleagues at the New York Blood Center. So by having this one, it's pretty fulfilling and exciting to make a big dent in the COVID pandemic.
That's incredible. So what should we be looking for starting tomorrow?
Well, tomorrow we're going to outline a path for how we're doing the clinical development in India, even though it took us a little longer to get into the clinic than the Pfizer and Moderna vaccines, because it's very quick to make a piece of messenger RNA. We had to make this through a recombinant protein technology, somewhat older technology. And now that we have it, because it's such a well-known safety record, we think we can move pretty quickly. So even though we'll be a little bit behind the Moderna and Pfizer vaccines, we're hoping we're not too far behind, and so that we can scale this up for the world. How quickly we can move this into places like the US or North America or Europe is a little less clear, since right now we don't have the full financial backing to move it into the US and Europe, but hopefully that'll happen in time as well.
What do you need to make it have that same kind of impact that you're saying the others can have?
Well, we think globally it will. What we're looking at with the COVID-19 pandemic is a pretty complex ecosystem of vaccines. You've got the high-tech vaccines like Moderna and Pfizer and the mRNA vaccines, and you have adenovirus vector technology. So that includes AstraZeneca, Oxford, and what J&J is doing. And the Russians have their own version of an adenovirus vaccine, as do the Chinese. And then comes along our vaccines. Also, Merck and Company will do a live virus vaccine. And you might say, well, why do you need so many different technologies? Well, the answer is they all operate pretty much by the same principle. They all work by inducing an immune response against the spike protein of the virus. And by now, everyone has seen a cartoon of the COVID-19 virus, the SARS coronavirus type 2. It looks like a donut with some RNA stuffed inside, and then you have the spikes emanating all around it. And those spikes are what are used to bind to our host tissues to cause disease. All these vaccines work by inducing immunity to that spike, and especially using what are called virus neutralizing antibodies, inducing our body to produce virus neutralizing antibodies. And there's differences in the scientific community about the best way to do that. The truth is probably there's multiple ways to do it. This is actually an old school problem in virology. I'm pretty confident we will have multiple vaccines. It's just that with the RNA approach, you can move very quickly, but then I think you're slowed down by the freezer requirements and the fact that it is a new technology. So if there's any bumps in the road, you always wonder, is there a problem with this new technology? So even though as ours started a little bit later, I think we'll catch up, and I don't think we'll be too much behind the RNA vaccines. And as I mentioned, low cost. I mean, the recombinant hepatitis B vaccine that uses the same technology is made for less than $1 a dose. So the idea that we can make this COVID-19 vaccine for less than $1 a dose and make it widely accessible for Africa, Latin America, the poorest countries of Asia, places like the Philippines and Indonesia is really exciting for us.
Well, thank you for all you're doing. I'm just showing everyone your Twitter feed here and just trying to understand all the descriptions there. Professor Dean at BCM_Trop Medicine, talk about the work that they do there. It's an incredible place.
Yeah, so I've always had a lifelong passion in studying parasitic and tropical diseases. I did my MD and PhD in New York at Rockefeller and Cornell, and my two dreams were always to make vaccines for the world's poor and to start a school devoted to poverty-related diseases. And even though we call them tropical diseases, they're really diseases of the poor first and foremost. So it's called the National School of Tropical Medicine, College of Medicine, and it's really I'm really lucky to have two amazing bosses. Dr. Paul Klopman at Baylor College of Medicine. He used to be chief of medicine at Mount Sinai in New York, and then Mark Wallace, who's the CEO of Texas Children's. Really gave me the opportunity to build that vision. It's kind of one of the cool things about Texas. Texas is still one of those places in the U.S. where if you have a good idea and we're willing to work hard, you can build it. It's sort of the old-fashioned idea of the American dream, and they gave me that great opportunity. So we have National School of Tropical Medicine at Baylor College of Medicine. It's still modest. It's modeled after the London and Liverpool Schools of Tropical Medicine in the UK, or the Swiss Tropical and Public Health Institute in Basel, or the Antwerp Institute, but it's starting modestly. We have 15 faculty, all wonderful scientists and public health experts, and all buying into this vision of a school for poverty-related diseases.
Thank you. Here is a question from Sumit. Why is the mortality rate due to COVID different in different countries?
Yeah, that's a good question. I mean, I do think there are genetic factors that underlie the mortality rate. So there's this amazing professor at Rockefeller University, who actually I've never met, but I've been reading his papers for years. His name is Jean-Laurent Casanova, and he has found certain genetic differences in people and their ability to produce interferon, which is an innate immune factor related to the virus. And I think that may have something to do with it. Also, it has to do with ICU care. I mean, one of the things that we saw in Europe, in Spain and Italy, and then New York, was the mortality rates were so high because you had those big surges on the ICU, and hospital staff gets exhausted. It's exhausting donning and doffing PPE all the time, and you can't handle that level of intensity for so long, and mortality starts to go up. So we realized pretty early on in this pandemic that we've got to stop hospital surges. So wherever you see big surges, which unfortunately now we're seeing in El Paso, Texas, and up in the north central part of the US, North Dakota, South Dakota, which now has the world's highest COVID-19 rate, which is extraordinary to think about. That's when mortality really goes up. And we're trying to get the word out that we've got to stop this. The only way to stop the surge is to, more aggressive social distancing measures and masks, and telling people now that we're in the past, when I gave those messages, there was an indefinite component on the right-hand side. I could never tell people how long it's going to last. But now that we've got vaccines being released to the public, probably in the early part of 2021, saying that we don't have to do that aggressive social distancing forever. In fact, we just have to keep it together for 3 or 4 months, because otherwise the numbers in the US are absolutely terrifying. They're telling us from the Institute for Health Metrics and Evaluation at the University of Washington, Seattle, that 150,000 more Americans will die between now and a week or two after the inauguration. All of those deaths are totally preventable if we could just keep it together and aggressively social distance, mask up, and basically stop it. And people don't want to do it because they say this interferes with my freedom and 100 different other reasons. I say, look, it's not in perpetuity anymore. Now we have brackets around it. Our life will get better in the spring. Just do everything you can to protect your mother and father and brother and sister for the next few months, and then we'll come out the other end, and we can have a good Thanksgiving and Christmas next year. But just organize yourself, maintain a small social distancing unit, try to avoid being alone so you don't get depressed, try to avoid contact with a lot of other people and not get COVID-19. And then everybody can get vaccinated. It's a very simple message, but very important message, because we're seeing too many people being incredibly defiant at this point. And this is not the time to be defiant. Just hang in there. Again, just 2, 3, 4 months and we'll come out the other end.
Folks, you're not watching CNN right now. It just feels that way because Dr. Hotez is on CNN, MSNBC, Fox, and BBC all the time, but he's gracing us here tonight on our 250th episode. We have so many questions coming in, folks. Keep sending in your questions. Tell us where you're watching from. Ashok says, what are the chances of mutation of the virus even after the vaccine is released?
Well, I get asked that a lot. RNA viruses mutate all the time. That's what RNA viruses do. But so far, I've not seen a lot of strong evidence suggesting that the virus is going to mutate to the extent that the vaccines are not going to work. It's quite a different situation compared to influenza virus, for instance, which influenza virus has enough antigenic shift and drift. You have to make a new vaccine annually. I don't think we're going to be in that situation. I don't want to say for certain because it's a new virus pathogen, but I'm hopeful that the vaccines are still going to be useful a few years out. The one caveat I will mention is for some of the vaccines that have brand new technologies, we don't really know for certain about the durability of protection, meaning the length of time people will be protected. And then, I often get the feedback, hey, Dr. Hotez, I'm just going to wait until we know a really good vaccine comes along. And I push back pretty hard on that. And I say, look, one of the things we don't want to happen is for people to delay getting vaccinated, because what vaccines do is they induce your body to produce virus neutralizing antibody. And next to masks and social distancing, virus neutralizing antibodies, the one thing we know, also with T cells, that'll protect us from going into the hospital or intensive care unit with COVID-19. So then the question is, okay, doc, which vaccine are you waiting for to induce the best levels of neutralizing antibody? And I say, you know what, I'm not waiting. I will take any vaccine that's authorized or approved by the U.S. Food and Drug Administration in order to get virus neutralizing antibodies in my system. I don't want to go through this horrible, horrible winter at the risk of getting COVID-19 without those neutralizing antibodies on board. And you know what? If it turns out that the durability protection for some of these early vaccines are not the best, or this is not the best vaccine, better vaccines are coming along later, so what? I'll get a boost with the new vaccine or with the same vaccine. But your most important job, other than social distancing and putting masks on, is to, if you have access to those vaccines, take it. It'll save your life and your family's life, and get you through this horrible winter and spring. And if later on other vaccines come along, or if the message coming from the CDC and FDA, it turns out the vaccine wasn't as good as we hoped, had rapidly dwindling virus neutralizing antibody, but now we have a better vaccine come along, you know what? You'll get boosted, but it will still have saved your life over the next few months. And that's, and if you think about it, that's and one of the problems is, it takes a show like yours, right, to say that. It's hard to say it in a 30-second UNICEF commercial. I mean, it takes time. And unfortunately, Operation Warp Speed has a lot of positive features about it, but one of the weaker elements is that there's no communication strategy. So that, one of the flaws that they have is they left all the communications to the pharma CEOs. And more often than not, they've fumbled that message, and we don't really have a good gap that fills it. So that's why, you're asking why I spent my whole Sunday talking on CNN, Fox News, and MSNBC. And by the way, it's not easy going from CNN, Fox News, and MSNBC.
No.
It's so revved up and polarized, and I'm trying to thread that needle. Sometimes I blow it, but I try to do the best I can, and to get that word out and fill the gap by the lack of communications that we have out of Operation Warp Speed.
Thank you. Dr. Sujana Chandrasekhar, who is a host of At She's On Call, a terrific show that I know they would love to have you on. She says, we just have to keep it together for a few months, quoting you, right, mask up, she says.
Yeah, brilliant. And not just mask up, but also the social distancing part. Even though there's some hard decisions to make. Let me give you an example. So my oldest daughter, Emmy, is a research scientist at UCLA and married, and she and her husband were going to drive from LA to Houston to come and see us for over Thanksgiving. And, we started, okay, great. But then the numbers started going up in New Mexico. El Paso is a disaster. And you can't drive straight, right? You have to stop. So I had to tell them, it broke my wife's heart, my heart as well, to say, don't come. Just don't come. It's too dangerous for you and for us. And, we'll do it some other time. And so, it's not that tragic, right? It's not as tragic as losing a loved one to COVID-19, but it's sad, right? So, having those kinds of tough decisions and conversations is depressing, which leads me to another point, that this winter is going to be a sad time in the nation. You're going to, especially if you remember in New York in March and April, you heard those sirens going day and night. It was so dreary, and you get sad and depressed. And you know what? That's a normal reaction to a very stressful situation. And that it will happen in multiple cities now across the nation, especially in our heartland this winter. And just remember, you will get sad, you will get depressed. And if you can avoid being alone, that's better. But if you can, the best is if you have identified a small social distancing family or friends that you can be with and not violate it as little as possible, and have a number for mental health counseling, because it's a normal reaction to get depressed, and have a number for some virtual mental health counseling. And just remember, this is not in perpetuity. This is just getting through the next few months.
You're absolutely right, Doc. Thank you so much. I know we only have a few minutes left with you. I want to bring in this is again different from how we do CNN. Our guest for our next segment is already here, and I want her to say hello to you because I know she's a big fan. I'm delighted to have Sunny Slaughter with us. Hi, Sunny, DEI expert and wonderful friend of the show. Sunny, I know you'll have a question or two for the doctor.
Thank you so much, Dr. Hotez. I watch you regularly on all of the shows, including Fox, and you are absolutely amazing. What I wanted to ask you, because I do a lot of work in public health, is you talked earlier about messaging. How can we get, or who do you think would really be the best people or industries to provide messaging around COVID-19 for Black and Brown communities? Because as you are aware, health disparity, this was normalized in medicine and in the resistance and really displacement of Black and Brown individuals when it came to treatment and trauma and this type of work. So who do you think would be best at that messaging, and what should that messaging actually look like?
So you actually asked a very profound and important question, and for a couple of reasons. Let me give the first reason why it's important. One of the things that I started seeing down here in the South, in Houston, the Houston Health Department puts out a list every day, and they don't provide names, but they provide age, sex, race, and ethnicity. And every damn day, it was, you go down the list: Hispanic, 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 Black, Black, Hispanic, Hispanic, Black, Black. This virus is decimating African American and Hispanic communities, also Native American communities, and that really breaks my heart. And by the way, the deaths. Everyone says, "Oh, the deaths are all in people over the age of 70." Not in the African American, Hispanic communities, right? And Native Americans. So 30 to 35% of the deaths in the Hispanic and African American communities are under the age of 65. So basically, this virus is robbing us of a generation of mothers and fathers and brothers and sisters. And the reason that I think is, especially in some of these low-income neighborhoods, they can't work. Guess what? They can't work at home via Zoom and Skype, right?
Right.
They're out in construction sites, they're out in family-owned businesses and restaurants and you name it, bakeries and dry cleaners, and they're getting hammered. And so we have to figure out a way to protect those populations and give them health information. That's problem one. Then problem two is the anti-vaccine lobby has been heavily targeting the African American community last year and this year. What they did was really awful. They have been flooding the internet, social media with very exploitative language. They did this with the Orthodox Jewish population in New York. They said, they started comparing vaccines to the Holocaust, and now they're doing it with the African American community. They're calling it the next test. You know what they said, right? The next test
experiment.
And they even, I don't know how they did this. They even staged a rally in the Riverside Church, which is one of the iconic churches in the civil rights movement, Reverend Sloan Kaufman and everything. So, and guess what? Now you've got these surveys that show a significant percentage of the African American population doesn't trust COVID-19 vaccines. They think they're being experimented on, and it's a normal reaction to being flooded with an active disinformation movement. And so, how do you fix that? And I don't have a simple answer. Actually, there are two components of this. One, I think getting the message out and finding important leaders in the African American community, get the word out. But then there's one place where I depart from my colleagues, because I've been on, I can't tell you how many Zoom calls I've been on in the last few weeks, about how to fine tune the message, how to get the message. And then I say something very provocative. I say, look, it's, all of the things you're talking about, getting that message out is very important. It's going to get us 30-40% of the way there, because ultimately we have to figure out a way to dismantle the anti-science, anti-vaccine disinformation empire. We've got to take it down, and that's where my colleagues get very uncomfortable, because we're not good at it as academics. We're not good at that kind of stuff.
Right.
To figure it
and
out.
I work with academics. So, and I do understand that. I just did. I am the recipient of the 2020 Community Service Award for the American Public Health Association.
Congratulations.
Thank you, from the Black Caucus of Health Workers. And I just presented about messaging on human trafficking, because that's my big specialty, and exploitation. And I do feel like the COVID-19 messaging really has a lot of exploitive factors for Black and Brown communities, and the narrative is so skewed in the way in which it intersects medicine in a continued negative way. So I think that is something that the Black Caucus of Health Workers and other public professionals and professionals like yourself really need to work on more. And I'm so honored to have you on Shree's show, because it does allow you to talk about your messaging and the information in a more full manner. And I'm definitely going to share this. Even though my community is very broad, I'm going to share the information because I think people need to hear what you have to say, the importance of social distancing. Now, even though I'm a consultant and I work from home, I've always worked from home until I had to go somewhere. So I wasn't impacted in that way. However, I do see that so many people, from a trauma standpoint and the mental health component, it's really impacting a lot of people. My son is home from Howard, and he was kind of living his own life on his own and having to be home with me this time. Although it started out okay, it's been a very long time, but we don't leave. Like, we're like in the house. We don't have people come unless and I've only had my daughter come, but when she went to Atlanta, I told her, you have to isolate for the 4 days before you can come back here, like to visit me just for a moment. And then we still social distance even in the house because she doesn't live here.
And see, the other problem that I think you brought up is, at least down here, especially among the Hispanic community, they're not getting that health information either. I mean, they don't know about the 14-day quarantine. I mean, it may seem obvious to us because we're well wired and connected, and we have situational awareness or paying attention to the news. But for a lot of low-income communities, especially, we take for granted that healthcare information is permeating into those communities. It's not. I mean, I talked to my colleague Catherine Coleman Flowers down in Alabama, rural Alabama. They're not hearing any of this stuff. So
I know
we can't take that for granted either.
I used to live in Alabama. I just lived in Alabama recently I've lived there off and on for 30 years. I was there. I've only been back in the Maryland area for 4 years, but I'm from New Jersey. So rural Alabama I know all the back roads, and I did a lot of work, boots on the ground in the community. So when we were talking about, I was the co-chair for the opioid caucus. And even those issues, when you start thinking about COVID-19 and what we're seeing at the intersection of not just race, but drugs and food insecurity, all of those things matter. And essential workers don't have access to PPE. And like you said, in communities in Houston, I'm doing some work there for a few folks, and the gap is tremendous. They're living amongst one another, very crowded conditions, and it's not only getting the community the information, but ensuring that they will listen and respond to that information, but they won't do it if it impacts their livelihood. And we all know this impacts their livelihood, even though it also impacts their lives.
Yeah, I mean, what do you do, right? If somebody has to, if to put food on the table, you physically have to show up in the workplace. So you're forced to make, terrible decisions. Now, do you save your life, or do you put food on the table for your family? We're the greatest country in the world. We shouldn't have to force people into making these kinds of decisions. So hopefully things will get fixed after January.
Doug, we would like to know if Dr. Hotez feels he's getting enough data and other information
from the federal government. Right now, I have to be honest. I know Admiral Giroir very well. He's sincere. I think. I think the issue is this. For whatever reason, some of the most important information about this epidemic is not coming from our CDC this year, Centers for Disease Control. For all the epidemiologic models, I'm getting it from the University of Washington website. I'm getting it from my colleague Lauren Gardner at Johns Hopkins, or Lauren Ansel Myers at University of Texas Austin, or Mark Lipsitch at Harvard. I mean, the academics have sort of created this informal network, and by now I know where to look for this and that, but it took time to do that. And again, this is something that has to be fixed. I mean, I do think tomorrow I have a paper coming out as I like to say, I want to make sure everybody sees it, so I put it in microbes and infection. So it'll be out tomorrow. But tomorrow or Tuesday, and it makes the statement that I think one of the best ways to depoliticize all of this in this new administration is take it the heck out of Washington and bring it to Atlanta, bring it to the Centers for Disease Control. Yeah. Let the federal response run out of that. I think that alone could help a lot.
Sure. Doc, I know you have to go be on Univision after this, so a couple of quick things to ask you. Number one, tell us about the big new book you have coming out, and we'd love to interview you when the book is out so that you can join us at that time.
That's very kind. It's one of the things that I did about a decade ago is I always wanted to be a writer. So I finally got that aspiration fulfilled. So this is my fourth single author book called Preventing the Next Pandemic, Vaccine Diplomacy in an Age of Anti-Science. And it's interesting. I wrote it a year before. I started a year before COVID-19. But basically, we're already seeing a decline in our success at fighting epidemics and pandemics, and it's coming out of interesting social forces that ordinarily we don't think about, such as the anti-science movement that I've been talking about, but also war, political collapse, urbanization, deforestation, and now and then the other force outside of the social forces, climate change, and they're combining in interesting ways. And I talk about my time as U.S. science envoy in the Obama administration. You know, when I was asked to help with the rise of disease in the Middle East and in North Africa because of all these forces. And so one of the points that I make in the book is that COVID-19, we think it was such a game changer. It was actually a culminating event of forces that were already starting around 2015. So I hope it stimulates some conversation and interest.
And when will it be out?
I think next month.
Oh, wow. Okay. So we'd love to have you back. I do want to point out that one of your books had a foreword by an unusual one-named person. So tell us about Blue Marble Health.
Oh, yeah, that was done by Cher. So I'd gotten to meet Cher a number of years ago, and when she was interested in neglected diseases. And oh, by the way, Cher is everything you'd hope she'd be. She's smart, kind, and interested. She's just a great lady. So it was a real great opportunity to get to know her over the years, and she agreed to write the foreword for the book. The Blue Marble Health book is interesting in that, you know, when we talk about global health, it's so much of the narrative is about looking at poor countries versus wealthy countries. And I think the world's gotten more nuanced since then. And one of the observation I found is looking at World Health Organization data or Institute for Health Metrics data, we came to pretty much the same conclusion that it's the poor living in the G20 economies accounts for most of these diseases. So it's the poorest of the rich, so poverty is such a driving determinant, including the observation that, and made in the book, we have 12 million Americans living in extreme poverty with a poverty-related neglected disease.
Yeah.
And it's the other piece to that is that's been hard to get people to accept that. You know, I had a lot of success in the 2000s raising awareness about this concept of neglected tropical diseases in Africa and the poorest countries of Africa and Asia. People got that, and we were able to scale up treatments. But the minute I talk about poverty and poverty-related diseases in the U.S., the lights go out. I just assumed that when I, came to this revelation that 12 million Americans live with a poverty-related neglected tropical disease, parasitic disease, like toxoplasmosis or Chagas disease in the U.S., that would really blow the door open. And the opposite has happened. And I still don't quite understand why. It's people don't want to accept that we have that level of poverty and illness, especially among people of color in the U.S. And finally, it got Senator Booker interested in this, and also a Congress member of the House of Representatives from New Jersey, Chris Smith, from Atlanta, and those three really went to bat for this, and we submitted legislation. But it's been, I wrote that first paper about it in 2008. So 12 years later, I'm still fighting that battle to get people to accept that there's that level of extreme poverty in the U.S. There's
a lot of good people that come out of New Jersey. I'm just saying that for myself. New Jersey,
including my wife Ann. So
really,
yeah, she's from Bergen County. So there you are. So.
Really, Bergen. I'm a Trenton girl. I know Corey. We did school choice together. Represented Chris Smith. He has done a lot of amazing things for people, including hostages across the country. But really,
he's not a household name, but he's done a lot of good stuff.
Yes, he has. Very quiet. And can I ask really quick? I know you have to go. Do you think part of the reason why Americans don't think poverty impacts us because of our arrogance?
I think it's arrogance. I also think a lot of the poverty is unseen, right? Back in high school, I was forced to read a book, and I didn't think much of it at the time. and then I dusted it off, and it blew me away. It's called The Other America. It was written by an activist named Michael Harrington, who talks about, it was actually the book that helped prompt Kennedy, JFK, and Johnson to launch the war on poverty back in the early 60s. And he talks about the hidden poor in the U.S. And everything said rings true. It's that level of poverty never went away. It just got more and more off the main roads, and people don't see it. And then also it links with other forces, for instance, climate change. So, if you ever listen to Al Gore and he talks about climate, one of the things he points out is that it's people who live in poverty are especially vulnerable. Why? Because people who live in poverty are forced to live in areas where they're more catastrophic, where they're more vulnerable. So it all kind of connects, and I try to bring some of those things together in the book.
Thank you so much for your work.
Thank you.
The last thing I want to just mention is that you wrote a book called Rachel's Autism Was Not Caused by Vaccines, or Vaccines Didn't Cause Rachel's Autism. Right. One of the things that we have to worry about is that even if you have the perfect vaccine, that tens of millions of people brainwashed by Donald Trump, Jenny McCarthy, and of all people, Robert F. Kennedy Jr. have poisoned the idea of vaccines for this country.
And they're doing a lot of damage. Robert F. Kennedy Jr. now on his Instagram site, the OG villain, the original gangster villain. So
wow,
the original gangster villains. Those guys are doing a lot of damage.
Robert F. Kennedy's son, who, by the way, done so much good on the environment, right?
He did. I just, I tried to convince him, but he's. I don't know what it is. I don't know what the drivers are for him and his colleagues, but it's caused an enormous amount of damage in this country.
All right. Doc, we'll let you go. Thank you so much. CNN, MSNBC, BBC, Univision, and tonight, My Daily Global Show. Thank you so much. Our 250th
episode. It's a real honor. Thank you for all your great work. God bless. And we look forward to following up with you.
I'm watching you when you're on everything.
Thank you. I appreciate it very much. Thank you for all your great work.
Thank you, sir.
Thank you. And a big thanks to Dr. Geeta Nair for bringing Dr. Hotez to us. He was fantastic, and we're very, very grateful. And now our co-host has become our guest. Thank you so much, Sunny, for being here. As you know, for this summer, we have spent 250 days in a row covering this pandemic, where we're covering the health, the financial aspects, the racial inequality, the racial awakening of this country.
Yeah.
And the way we did that was we came to you to say, teach us about what we need to understand, because this is what you do every single day. You've been recognized not just by the Black Caucus of healthcare workers, but so many other organizations. And you came to us on 2 episodes back to back. On a Friday night, we did an episode we called A Horrific Night, a Week in America, the week after George Floyd's killing on camera. Let's not forget, it was not some accident. It was murder on camera. And then you joined us for an episode with Adam Server and Keisha Center and others. And then on Sunday on the New York Times read-along, you came and spoke with Joe Stiglitz, Nobel laureate, who I watched as he listened to you to learn from your insights and what you have been able to share with us. So we're very grateful to you for being here. We wanted you to reflect on these 9 months of pain that this country has gone through. As you said, the healthcare effects have been felt extra by the Black community. On top of that, the troubles with police brutality, and then on top of that, the president going on camera almost every day and calling out Black people and others as being part of the problems in this country instead of the victims in this country. So I'd love to give you a few minutes to just reflect on that.
Thank you so much, Sree. It was such an honor to be on with Dr. Hotez, watch him regularly. The past several months have been almost overwhelming. And to use a phrase that we've heard so often, Um, I almost couldn't breathe, and I know there's so many others who felt like that they cannot breathe. The constant rhetoric coming from this current administration and the pain and the disinformation and the misinformation and the violence and the ignorance has just been overwhelming. I know on the 4th of November, as many of us, millions, watched, still holding our breaths, and for the week that ensued, and even currently, we have been astounded at how much this president and the people around him have just really shown America to be fractured. I never realized how the place that I always thought and continue to think is great, the racism that lingers for all of these years with the, when we unfolded and talked about the 1619 Project on the New York Times read along and what we did on the show. Every day in America, there's something else. There's always something else. And until we can get past the something else, get past his words, his presence, I think we will continue to be in pain. But I don't want any of us to be disillusioned by the fact that him leaving office means that those who made him complicit and continue to be complicit in that behavior are not, they're not going to do anything differently. We have seen a man murdered on television, George Floyd, and that changed the entire crust of how we see ourselves and how we see one another. It was very painful, Sree, and as you all know, it continues to be painful, not just for Black people, because while the issues center Black people, this is really about all people. This is really about all of us and how we all feel, how we see ourselves, how we see America, how others see America, and how we see one another. So we have gone from a tragedy to really a mirror that makes us look at ourselves differently, which is one of the reasons why I asked Dr. Hotez, did he think we were too arrogant? Because I believe that Americans and America has become so arrogant. We save everyone, and now we are the ones that need to be saved. Our righteous indignation has caused us to become more aware of our faults. We have normalized so much things. We have normalized poverty. We have normalized pain. We have normalized racial perspective. We have normalized healthcare disparities. All of the things that we thought we were missing, they're not new. What COVID did and what 2020 has really done, it has shown us who we are. And we should not be proud. We should not be boastful. We should not be bragging. This should be, we are at a point where our humility must begin to form our perspective, our place in this world, and our presence among one another. How we speak to one another and how we care for one another, our humanity must really stand before us, not our arrogance going forward. And I know there'll be some people who will not agree and who will say, well, she's wrong to say that. I'll just say this, it is what it is.
No, thank you, Sunny. So So well said, and so grateful to you. Look at Therese Steiner says, "Thank you, Sunny. Your honesty empowered me. I was first introduced on the read along really touched me. I shared that episode widely with so many other comments coming in here. Neil has shared a link to that episode and says, I logged on to watch you. I was on an important call, but I said my sister Sunny is about to speak. And she's
Thank
also
you, brother.
He's also posted a link to the episode where Joe Stiglitz, Nobel laureate, was listening to you, as we all were, to your thoughts and sharing your ideas. Mark says hello from North Carolina and says, just thinking about you, Sunny, today, just closed a Black business conference, and one of the speakers, Veronica Hardy, is also involved in the difficult fight. So nice coincidence that you're here. The Black business community that I heard was very passionate about using more of their financial power and fighting against racism and economic injustice. That is so important, and one of the issues that we covered multiple times on this show. We're very proud of how we've done that. We, of course, always more to do as we go forward. I'm just showing folks sunnyslaughter.com and this very nice image here. Doug Levy says, thank you, Sunny, for being such a good influence on us all.
Oh, thank you.
Doug has been a guest multiple times on this show and is just a great friend. Tell us about this. You've taken the word aggressive and saying maybe a synonym could be assertive. And this is one of the issues with perceptions, especially of Black women. And we saw that with Kamala Harris. She had to kind of control herself, because if she reacted the way I would to any of the insults being thrown her way, imagine being called a monster by the President of the United States, and she just had to keep calm, because otherwise the stereotypes of the angry Black woman would be used against her.
Yes, that is so important. Catalyst does this thing, Catalyst, the organization, and where you can put in your picture and different things come up. It is so true. Watching Kamala Harris, Vice President-elect Kamala Harris, and of course, I'm representing the HU today, Mom Howard, but
oh, is that what it says? Because your t-shirts are always great. So it says Howard Mom, is that right?
Yeah. See, I got to stand up here. This is the Howard. Yes, this is Howard University. So representing the HU. I'm a Bison mom. My son is a senior at Howard. So go Bisons. But as the president, and I really hate to use that term with him, lashed out at the first Black and Indian woman, first woman of color to ever become the vice president-elect. But just her as a woman, even before, it's so horrifying that she had to do what we always do as Black women. We cannot be aggressive. Our tone can't be wrong. We can't assert ourselves in a certain way. We can't say things. And when things are said to us, we are expected to just smile. Just like she did when she told Vice President, I'm speaking. We all knew what that meant. She didn't want to say, I'm speaking. She wanted to say something else. But it is a stigma that really resonates with Black women. And I get it all the time, because I am not quiet. I usually say what I have to say. I try to say it with a smile. Sometimes that does not work, because we carry that weight. We carry that pain. And while I have sisters across the races, across the cultures, and across the ethnicities, they know this is a Black thing. This really sits with Black women in such a way that we are mass muted. We are barred from saying the things and talking about the things that bring us pain, because we will be seen as overly aggressive. And if we cry, then we are seen as weak. So the balancing act really is constant. And can you imagine walking around constantly not being able to be who you are? You can't feel too much, and then you can't respond too much. So you always have to be proportional, not to who you are, but to how others will receive you and perceive you. This is a daily struggle, and we learn it as little children. So when Kamala's mother was talking to her, and even though we whispered to our children and our girls, okay, you're going to be strong, but you can't be too strong. You can't say what you really want to say, because then even our own, there is something that Black people say, and I don't know if you've heard it, that all skin folk ain't kin folk. And that's what we say, it just like that. All skin folk ain't kin folk. That means that everybody that look like us ain't always with us. So we have to be careful. And what an honor to have Vice President-elect Kamala Harris, a Black and Indian Asian woman, strong, articulate, brilliant, diverse. But like she said, she won't be the first. And none of us can expect her to carry all of it. So while my granddaughter can see her, it is my responsibility for my granddaughter, who is 5, to show her the way. Because Kamala has to lead the way. But the rest of us, you, Sree, everyone that listened to you, all of us, regardless of our skin color, regardless of our ethnicity and culture, and particularly women, all women, we can't put everything on her shoulders. We have to do our part. We have to lift one and pull one and carry one and walk with one. We have to do that together. Because when she looks behind her, she needs to see that we are with her, but she can't carry all of us. We have to lift her up, keep her held high, but we have to do our part. She has already walked through the door. Now we have to protect her. So when you saw what they call the Divine Nine, and that's all of the Greek organizations, when they did the Divine Nine and the Strolls and the AKAs and the Deltas and all of the rest, they're forming a circle around her. We all have to form a circle around her and Joe. Sree, we have to form a circle around you and your family, because the work that you are doing and your team is so valuable. We can't lose sight of your leadership and your guidance. So when we see a leader, we have to protect them. We can't let them carry us. They walk through the door. We have to protect the doors. We have to be willing to stand with them, even when we don't always agree. But we do have to continue to lift, support, but not expect them to carry. We want you, your platform allows us to speak. That's good. But we have to protect you. We have to protect your family. We have to protect those that lead so they can continue to lead. We got to do our part behind them. And what an honor to continue to have access and opportunity to be on your show. And oh my God, you get some of the coolest people. Oh, like, you know, I really think I'm like hot stuff when I come on the show and everything, because I'm like, oh, I'm on here with the doctor. I'm watching.
Well, you are hot stuff, and look at what Mark is saying. You're such a leader yourself,
Oh,
and he says Kamala is such true fire, and I love that
yeah,
she acknowledged the shoulder she stands on, acknowledged that so many more will follow her. And Mark has been another great guest on this show. He was on an episode to talk about allyship and how we can be better allies of Black communities and what we can
yes.
do and what we need to do. I know we only have you for a few more minutes, so I wanted to show everyone your Twitter feed. And first of all,
Oh,
it's Sunny _Slaughter. Tell me why you picked this image on the cover, that title image.
I had this up for a couple of months now because Donald Trump Sr., there was, every day he says something. There was something that he said, and his supporters, the Senate and those, you know, were supporting him. And I really think while we focus so much on him, we cannot take our eyes off of those who were complicit. And the work that I do in law enforcement and you know, that type of thing always talks about, you know, who else is complicit in the crime and the behavior. And there are so many individuals that, although he might be no longer as the president, he still has a large bully pulpit. And more important, the people that surrounded him and continue to do his work are dangerous. And so the cost of integrity, when I saw this, I was like, that's it. Our integrity has been compromised in a law enforcement and an investigative way. I would say Donald Trump and all of those who have been complicit in his behavior are dangerous actors. They are bad actors, but they are also dangerous actors because I've been doing a lot of having conversations about, on the law enforcement side, about integrity and misinformation and disinformation. So there are a lot of investigations and individuals and agencies really kind of focused on messaging. And so I haven't been tweeting as much because the cost of integrity has been on the line. And I have been having a lot of conversations and trying to focus on how we look at messaging and the cultural compromise of messaging. And our integrity has been on the line for a long time, and our children really are watching. They are watching what we say, but they are also watching what we do. And when we do nothing, it compromises our future, it compromises our presence, and it compromises our perspective.
You're so correct. Diane says, thank you for your gut-wrench honesty, Sunny Slaughter. That's a great compliment. And Rahajan said, I've heard all kinfolk, sadly, in the Filipino and Indonesian communities. That's also true. Rahajan was a guest on our amazing episode around July 4th and what it means to be an American, and he shared his story. Before we let you go, I do want to ask you to share again, for people who haven't met you before, part of your story about that flag that you keep in your house. Normally it's behind you. I don't know if we can quite see it, but also
No, it's in the living room now. So thank you so much. So I am the great niece of a soldier. His name was Corporal Jonathan E. Sykes, who was murdered during the Vietnam War. And he was decapitated, saving the lives of so many individuals. And my grandfather was at the Philadelphia Naval Shipyard on the teletype, and he went to get some coffee. And when he came back, the next teletype that came over was notifying him of the death of his own child, his son, his firstborn. And for years, my nana in Baltimore had the flag, and my mother died at 49, almost 23 years ago. Yeah, because my son, almost 22, a little more than 22 years ago. And so the flag never passed to my mother. I am the firstborn and the oldest, so the flag came to me. And last year was the first time that I actually put it in a box. It has, I don't know why it has taken me so long, but it now sits in my living room when you walk in the box and in the case. And it is a constant reminder of my family's sacrifice. But I come from a family that serves, so we have a lot of soldiers. And I was married to my first husband was in the Navy. So, and then my other uncle was also murdered in the Navy. So my own Jonathan was a Marine, and my other uncle that was murdered was in the Navy. And then I wound up decades later, being on the same military base in San Diego as him.
Oh, wow. So I'm learning more every time we meet. I'm going to just bring onto the screen with us our producers who have worked every day for 250 days, no vacations, no holidays, no breaks. I want them to come on here and say hello to you. And then before you go, I do want to ask you a question, and they may have a question as well. That's Vandana, and that's Rose. And let's take this trademark off of here.
Rose, you got your hair done. You look so gorgeous. Both of you ladies.
Really? I just took a shower.
Oh, it's cute. It's cute. Hi, Vandana. How are you?
I'm good. Thank you. Thank you so much for coming back on. It's always such a pleasure to have you on our show.
Oh, I'm so honored by both of you. You are the best producers. Now, he has to let you have at least one day off.
He does.
Birthday.
He's taking some days off.
Birthdays this summer, right?
Yeah. He's taking some days.
I do. If Vandana and Rose have a question for you, I welcome it. But I do want to ask Sunny, one thing that has struck me about you and so many other African Americans, Black folks in this country. Now, one of the things we learned this summer is capitalize the B, which a lot of Black folks are doing all the time, but now journalists are doing it. How do you keep the faith? How do you keep supporting this country and serving this country as you and your family have when the country has let you down so much? How do you keep that going? A lot of other people would be not able to do what you and other people have been able to do.
Well, for me personally, it is because I didn't come from a family, like I don't have a long history like many people of PhDs and people who were in service. I am the one, and I just believe that I was purposed for something. I didn't know what it was, but I've always had it. And this is my country. This America is who I am. So when people say go back, the only place I can go back to is Trenton, New Jersey, at the St. Francis Medical Center where I was born. So this is where I am. This is who I am. And this is where I belong. This is my country. So I fight for what is mine, what I believe in, what I have been purposed to do. So I'm not visiting. And I believe in that saying that be the change that you want to see. Well, every day I'm trying to change something and make it better, not just for me and my children, but for all people, even the ones that I don't like. Now, I'm not one of those Black people, you know, like at the church where something bad happens and they say, oh, I forgive you. In all honesty, that is not me. I'm just like, no. I'm like this, no. I'm going to still be mad at you for a while. I might always be mad at you. And I might not speak to you, but I am not that I'm not that kind of forgiving, but I am determined that while I am here, I intend to do what is necessary for all people and for my country. This is my home. So I don't even like New Jersey, like Trenton. I love my home. Like I'm always from New Jersey, but like I'm not going back there. I want to be free.
Do you feel empowered after this horrible election? Even though less than half voted for Trump. How do you see where we are now? Are you hopeful? I guess.
I feel hopeful. I also am very realistic. I do not think I think there is so much to do, which is why we have to have realistic expectations of the incoming administration, that it is like an onion they have to get in and then start peeling back. At the same time, we're in a crisis. So I think I've been deeply damaged, but I am hopeful that things will, not necessarily the administration will make it all better, but all of us will do our part to make it better. I just think we're all responsible. We can't look to them. What you all do regularly, Rose and Vandana and Sree, what you are doing right now, this gives me hope. This is hopeful for me, that this platform and the work that you all do will continue, and voices will be heard that other people won't ever hear. So yes, I'm hopeful.
That's really great to hear, and it is one of the things we try to do with the show, is bring voices that we don't usually hear in the show.
Sure.
It's
Let's
important.
see. Mark is saying, we believe in the promise of this country. Yes, we understand its history, but we believe in its future and refuse to let it get derailed. Just my 2 cents. Voice of a strong Black man, as you hear right there.
And if we don't believe, and if we don't keep trying, then that means I don't see a future for my granddaughter, who is 5. And I have to see a future for her. I have to believe that change is possible, and that we're all working towards the promise. Even if some of us are not, I have to believe that. She turned 5. Her name is Faith, ironically. She turned 5, and she's a little pistol. And my daughter, my oldest daughter, says, she's just like you. And I start laughing, and I said, no, you think? And she is very spirited. But I see her pictures on my phone, and my children and all of you. And when I cry, I'm okay being vulnerable. I will cry my eyes out, but then I have to get back up, because staying down gets nothing done. So you all, thank you for all that you do every single day. Yeah, and children is not by birth. So I have a lot of children besides the 4 that I gave birth to. I have a lot of kids. Children are by birth, situation, and circumstance. We are all together in this together. Shree's children, my children, all of us, we're all family.
Well, thank you. Rajan says, amen. I don't have any children, but I want a better future for my 5-year-old niece, granddaughter, Kayla. So that's beautiful. Oh. And I wanted to share this tweet I saw today by @AngryBlackLady. Imani says, media asks people, why do people support Trump? Red hat MAGA people say, we don't like colored folk. Media says, what drives them? Jews neither. Emotionally, spiritually, did we mention we don't care for Blacks and Mexicans keep coming over from Cuba? We don't like that. And the media says, we'll never know. The media keeps giving these right-wing, terrible people, they don't call them terrorists. They don't call them the same things that they call Black people or people of color. And I just, this tweet really, you know, we're laughing at this, but otherwise we'd be crying.
I think I think when we talk about messaging, Sree, you need to teach the media about messaging. Like they need a class. Because one, I hate when they ask the same questions over and over and over. They ask the same questions over and over and over. And I'm like, why do we keep asking them that?
One wants to get it. One of them wants to get it.
And I'm just like, oh my gosh. But they do fuel the flame, and they have, of Donald Trump. So see, I told you I knew Donald Trump before he became president, because of the casinos. So I used to work for the Division of Gaming Enforcement.
I met him.
So I'm the first and youngest Black person to work in the New Jersey Attorney General's office for the Division of Gaming Enforcement. He has not changed, but they give him too much access and too much play and too much everything. And you're right. They don't call it like it is. It's just awful. It's just really, really. And when the men come on, mostly men, they come on television and they kind of talk around the stuff that he's done with not, giving Biden access to, the funds from GS. Why don't you just say that he's wrong? I just don't understand all of this foolishness with them. But I think you should do a class for the media and teach them what the people want to hear.
Thank you. I do want to show you this. This is the header image on Angry Black Lady. Do all the things with the confidence of Ruth Bader Ginsburg dissenting. And that was another thing that we went through on these 250 days. We lost several icons. As you know, we lost Ruth Bader Ginsburg, Chadwick Boseman, another bison, by the way, as you know, John Lewis, and so many people that we talked about. We did episodes and shows and comments and all of those people. And that's not even counting, obviously, the 250,000 Americans who lost their lives needlessly in this pandemic for bad management, really.
The loss of Chadwick Boseman was a crushing blow to Black people. Notice I didn't say the community, to Black people. He was a representative of hope and power and strength and presence that was different than John Lewis. He signified and empowered everything about who we are as people, our dignity. That's what we saw in him. We saw dignity, and in the movie, and to lose him so young, and with Ruth, I almost lost everything. And when RGB, oh my gosh, the epitome of women power, nothing to do with race, just women power. She was, my mother died of pancreatic cancer. So I saw that. To see it, it's one of the most debilitating forms of cancer. And she was so strong, so tiny and so strong. And she was a different kind of icon, even from John Lewis. She and Chadwick Boseman really showed us as people something about strength and integrity and who we are in a way that you know, John Lewis was such a powerful man and a civil rights icon and leader and determined. I've walked across the Edmondson Pettus Bridge. I've taken my children across there. And I also spent time with we called her Dr. Amelia Boynton Robinson. I got my award for human trafficking with her. Do you know who she is? Dr. Amelia Boynton Robinson, you know it's called Bloody Sunday?
Yeah.
Do you remember there's a picture? They call it Bloody Sunday because there was a woman on the ground when they were all there, and her blood, she was hit in the head, and her blood was running down the bridge. That was Amelia Boynton Robinson. That's her. She is the same woman that you see Barack Obama pushing across the bridge.
Yes, I remember this. Yeah.
Well, that's who she was. And Bloody Sunday, that was her picture. That's her in the blue. Well, I'll send you a picture of the two of us. I got to spend time with her and my very good friend, Harry Belafonte. The civil rights leaders, Harry Belafonte and Sidney Poitier, created the Southern Christian Leadership Foundation. And they would go to her home. That's the home that they went to when they were doing some of the gathering for the civil rights movement. So when I got to spend time with her, I received the Bell Hat Award, and so did she, and we got it from Harry Belafonte. And then she and I spent time together talking, and I was so enamored of her. She was in a wheelchair. She was like almost, was she 100 then, I think? Yeah, because she was in a wheelchair then. And you know, I said, oh my God, I can't believe I'm like with this legend. And I said, I'm so honored, and the tears. And she just said that she was honored to meet me and that she was passing the torch to me. So to have that moment and her say those words to me, it is, I didn't grow up in civil rights, but I became a part of, I spent time with Fred Shuttlesworth and Judge Helen Shores Lee, who was the daughter of Arthur Shores, who was Arthur Reed's attorney for Brown versus the Board of Education. I was Helen's secretary. And when the movie Four Little Girls was made and Spike Lee made it, I wrote for the Times Magazine the article that Helen had published in it for the movie. And I am friends with the sister, and I was friends with the McNair's mom and dad. Mrs. McNair died not too long ago, but they were, she was one of the four little girls that was killed. And the pastor and first lady of the 16th Street Baptist Church, we're like family. That is Candy and Reverend Price. They are there now. We all went to town at the same time, about 17, almost 18 years ago. That's when they took over the church. The same church that was bombed, they're like family to me. So there's a lot of history there in a place that really resonates with Black people, but all people, because there's a great mixture of people who don't look like me as part of the civil rights movement. And now today, we are the movement. The four of us on this screen. This is what the movement looks like.
It's just had a change of medium. It's just online now. It's there.
It's an honor, but we are the new movement of civil rights and social justice. Here we are. This is the face.
Here
of the
is
movement.
Raja linking to Harry Belafonte on his inspirations, activism, and confronting racism. And there's this International Civil Rights Walk of Fame, and this is the Harry Belafonte information. Sunny, you're incredible. You gave us more than an hour of your time, as you always do. I'm so grateful to you. Thank you for being part of this family. Thank you for being part of this community. We are switching from doing 7 days a week to 1 or 2 days a week going forward. And as events warrant, as they say, and we hope you'll come back in the weeks and months ahead and talk to us, and always keep sending us names of folks who don't otherwise get a chance to share their stories. We'd love to have them with us. And we're so grateful to you for your friendship. So thankful.
I do have some people. I was actually just talking about you the other day, and I'm going to email you all because we have World AIDS Day coming up.
That's
and
right.
There are, December 1st. So there are a lot of things that you're going to 1 or 2 days a week.
Yeah, we're going to go to 1 or 2 days a week starting this week, so that we can give these two ladies a little bit of a break. And I think every day for 250 days was a lot. And now we're going to go to 2 days a week and to see how it feels and how it goes from there.
Thank you so much for always thinking of me, Rose Vandana Sree.
Thank you. I promise we'll do something around World AIDS Day on December 1st, either that day or the day before or day after. So production team will work on that.
Yeah, I'm going to send you something. I'm going to send you someone.
Thank you. We'd love to. Would love to have them. Thank you, and thank you, Sunny. Good night.
Good night, all. Be blessed.
Thank you.
Wow, she was amazing, and just one of the many, many people who made this show over the last 250 days. I wanted to hear from both of you to kind of reflect on 250 days, 9 months of incredible work. I'm so proud of what we've done together, the three of us. I don't think Rose and London have ever met in person. I think they've only met here.
No.
And when we started this, it was going to be a phone call, and I said I need some help. And the other people said they'd help, but they didn't, show up like you did right at the beginning and work so hard every day and produce some of the most meaningful conversations of this entire period. This is a time that we will all look back at. Our grandchildren will ask, what did we do? And we'll be able to show them, here we can kind of overwhelm them with the work that we did. And I'm incredibly proud and honored to work with the both of you. And the people who go through the fire together learn the most, and will always just be so grateful to both of you. So I'd love both of you to kind of reflect a little bit. If you want to talk also about any of the guests you loved or moments you remembered, we could try to pull them up. We didn't really, spend time trying to put together a greatest hits or anything, because that would be an insult, because every day we learned something. Every day we made a connection. Every day we touched the lives of so many people, and I'll never forget that. So Rose, take it away.
Okay. I thought I would sit down with the list of people we've had on the show, and I printed it out, but it came out like this. I don't know, the print is like, I need a magnifying glass. So, the chance to meet so many people, and sometimes we planned a show around a person, and then sometimes it was around a topic. So it was around the one we did about Connecticut under COVID. So we heard from, community leaders about what was happening in their communities. And other times it was, we met, we had Maria Ressa on the show, and she just such an icon of press freedom. And oftentimes I think our experience has been that people don't disappoint. We haven't, people who have these amazing reputations, often they're humble and they speak their mind, and I think we really had a chance, to engage with people in a longer form than most, quick news shows. So
yeah, and you heard even Dr. Hotez say that he found it. He said we need shows like ours, unlike CNN and others, where there's just not enough time, where you get 30-second sound bites or 1 minute sound bites.
Yeah.
And so he talked about that today. And this is that episode you put together, 73. So so long ago, almost 200 days ago. Reverend Carl McCluster, State Rep Carla Rochelle, and Pastor Yolanda Hernandez. Just look at the diversity, and I don't mean just of race, but diversity of interest, diversity of age, diversity of background. And you pulled that together in like a day. It was like incredible that you did that. And the Reverend then helped us with other guests and other shows, and it's just like magic.
I saw him on our local news. He's a veteran, so they profiled him on the Channel 12 news. And it was good to see him. I sent him a note today saying that I saw him and keep in touch. So,
and he's married to an Indian woman, we learned, and we there's so many people we talked to who were like, I would have, if this was any other time, like we would have found an excuse to grab a drink, or if you were in the city, meet me for lunch, and we were not able to do any of that, which was part of the kind of the structure of the show and of its time, that it was all kind of one-time touch points rather than trying to build that relationship, and that made it hard. But I'm just so grateful. And you mentioned Maria Ressa, who is this incredible Filipino journalist fighting Duterte and doing so much good for her country. Just amazing. And Duterte, we mentioned so many times on the show, because he and Orban and Netanyahu are all these people who are in the Trump mold, and friends of Trump, who are these right-wing leaders, Modi and others, who all, even she, who Trump always seems to be fighting with, they all are of the same Trump kind. Bolsonaro, we mentioned him many times. We did an episode about Brazil under COVID. All of this has just been amazing. Vandana, your thoughts?
Yeah, it's just been incredible. We've had so many amazing people, and like you said, I was learning every single day, and I'm so lucky and grateful to have learned not just from both of you, but also from all of our guests. And just personally, I've just been thinking about the changes I've gone through in the last. Has it really been 9 months? But I've moved houses, I've moved cities, and through all, had different, I've had good days, bad days, and through all of that, the show was like a touchstone, and it was a constant. I'm grateful for that. So it's been, I can't believe it's been 9 months. When you said that, it took me a second. 250 as a number is different, but 9 months, it's a whole other ball game.
Alan Cat says, does this mean I'll have to make room for Rose on the couch every night? So let's tell everyone who Alan is. He was such a great guest on our show when very early on we did an episode about children's authors.
And he called some of his friends who, they know each other from various, going to lots of book events, and they did a show for book authors. They read from their books a little bit, and they, I guess, they were, we'd say, kibitzing each other about, and just having a great time.
And this is not that episode. Let me see if I can find it. But
it was so funny.
Yeah, he was so great on that episode along with other authors, and we had such a great time.
Oh, and then we had one of the authors was Peter Larangis, and his wife is a cabaret performer, and she came in one night. We had a night of piano.
Yeah, cool. We just sang together. It was incredible. We've had a magician come on. We've had musicians. We've had comedians. It's just been incredible. Actors. This week we had Fiddler on, like, actors have been in productions of Fiddler on the Roof, which is insane. We've had Soumya Swaminathan in the middle of a pandemic.
And that one, like,
the head of the WA, the chief scientist
head of the
health organization.
It just,
and I think we were going to celebrate our 200th, mark the 200th day, but that day you got an interview with one of the top people at the WHO, so we just didn't celebrate it.
That's right. I remember that. You're so right. We didn't get a chance. Let's see who else is here. So, Alan, thank you for your incredible time with us here on the show, but also for lending us Rose for these 250 days in a row.
And for putting us in touch with brilliant guests. Alan has
so many guests,
including our guest on Fiddler on the Roof. Thank you, Alan.
Yeah, I remember
we had his friend Jerry come back, Jerry Kraft, who how he made art on his computer, and we could all created the whole scene, the whole page for us. And I think Sree, you got a little, you got a notice.
Yeah, I did. It was great.
Yeah.
Lori says you created an amazing platform. I learned so much from all of you and your guests. I will miss the daily inspiration. Thank you, Lori. And you've been with us every day, and you've taught us so much as well. And how your organization, the GPCC, the Greater Providence Chamber of Commerce, has been so resilient in through all of this. And the Tarakani Lectures, named after your late husband, the great Jim Tarakani, investigative journalist. Through working with you, we got to meet Nick Kristof and Cheryl Wu Dunn and Christiane Amanpour and Dan Barry and Dana Kelch and Charlie Bacht, all of these great journalists. And
professional highlights. I mean, personal highlights for me. It's just incredible.
And then Mark, who was a guest on our show, says, I remember the powerful moment you had with Simon Tam, who went to the Supreme Court as a Supreme Court case named after him because he wanted to take a racist name and use it for his band to make a First Amendment point. And by the way, Lori, we should talk about him being a great guest for a future Tarakani lecture, because the First Amendment and what he fought all the way to the Supreme Court with. And Alan says, let's keep talking about me. And Daryl's having a good laugh. Let's talk about Alan for a second. What's it like to live with a professional, funny guy? Is it all laughter, or do you sometimes have to say, Alan, stop, we're talking about something serious?
I've been asked that question many times, and I like, what's it? People, other mothers, like they say, my husband's so boring. What is it like to live with him? And I say, it's an experience or something. Is he always funny? And I say, yes, of course. But there are many people. He writes comedy, and we had lived in Los Angeles when we first were dating, and there are many comedy writers you meet who are very sour, and they really aren't. They're not funny. So so I got lucky. Yeah.
So we'll pretend he's not listening to this. But do you ever wish he would just turn it off sometime?
Well, the kids don't laugh as jokes as much as he'd like.
Well, what are you doing if you're a dad and you're a real comedian? You're really funny. Do your dad jokes get taken a little more? Do the kids laugh more than my kids do? Probably, though, right?
No, they've heard them, so they're like, oh, we've heard that before. That he's got to keep coming up with new ones, and then we also have things where my daughter tries to learn a joke, so she'll practice 10 times to get the punchline, and with him that it just comes to him. So
amazing. Now he says time to stop talking about him. And Stefan says laughter is always the best medicine. Alan is a joy. And Diane says, thank you for keeping us all connected and sane during these insane times. Forever grateful. Thank you, Diane. And you, Diane, were such a part of all our shows. You had so many guest suggestions among your friends and people, your colleagues. It was so great to have them all with us. We learned a lot from so many of them. Mark is saying that he still needs Rose and Vandana on his shows that he does. I got a chance to be on one of his shows, and they were terrific. Vandana, remind us of that incredible guest you got on the episode we did about allyship with Black folks. Mark was one of our guests, but tell us about that. That was, I'll never forget that episode.
Yeah, we had a man named Rahul Dubey on our show, and I happened to be scrolling Twitter at 4:35 a.m. for some reason, and saw this tweet about this man who'd opened his home to protesters in Washington, D.C. who were being tear gassed at the start, in the first phase of the Black Lives Matter protest, right after George Floyd's murder. And I think he had about 100 people in his house. And he just opened his door to people who'd just been who's crying and needed milk and water to just kind of calm down.
You got milk for them because they had tear gas.
Yeah, they had been tear gassed. Yeah, and he just opened up his house to people who needed refuge, and I reached out to him, and he was interviewed on BBC like hours later. So I got him right at the right time, and he came on our show, and he talked about how instinctive it was. And I mean, we talk about allyship a lot, but he demonstrated allyship just in a very simple, powerful way. And even when he was on our show, he was talking about how we don't need to kind of valorize it or glorify it. He was just someone, a neighbor, somebody who was helping out. And it gave us a little bit of resolve as well.
It also gave us the background that his own parents were like, why are you doing this? Like he had they were always fighting different prejudices, which was very interesting.
Mm-hmm. He just opened his door to 100 people streamed in, and we're all there. And I was reporting on that story as well. And I spoke to someone who anonymously, who had taken refuge in his house, and he spoke to me. He must have been exhausted. He spoke to me at 8 a.m. After having been up the whole night, and was like, Rahul Dubey was incredible. He just opened up his house and let us in, ordered pizza for us, and he must have been exhausted as well. He would have stayed up the whole night, and he was just on our show.
And here is Rahul, and there's Mark and Kaushar Mohammed, who does a lot of work on equity and diversity. And that was just the fact that this could have been a 1 week worth of conversation and putting this together. We did this in hours. And this is because really of the hard work that both of you are able to do, and our audience encouraging us and responding to us every single day. And when people ask me, why are we stopping the daily show and moving to a little longer time period? Part of it is because I feel like there's so much more we could have done with each of these episodes, and keeping in touch with these folks. And there are episodes, multiple episodes, where I didn't even have time to write a thank you note to them because we're going right into the next episode. The things you see on television, these daily programs you see, like Jake Tapper or any of them, evening news, they have dozens and dozens of people working on them, and they have entire departments that do what three of us were doing. And it's just kind of a miracle that we were able to pull it together. And I say that not to boast, but just to say how much work that was. And I feel like along the way, we could have done more with these, taken each episode, chopped it up, shared it, given links to people, made connections, all of that, done more research. We just didn't have time because we were just going and going and going. And it was just an incredible experience to look at it from that point of view. And that's
Sree,
why
how many guests have we had on, Sree? I think over 400.
Well, I've got to do that final 10 episodes. We could, if we had a quick way of doing it, we could tell you. But here we had 441 guests with 10 episodes to go. So presume very close to 450 plus guests. And then look at that ratio, 249 of them were women. I'm very proud of that, that we did, we had more than 50% women. We could have had even more, and 72 cities in 20 countries. And you can see the global map behind us. You can see the 20 countries. I wish, one failing on my part that we didn't have an episode built. We talked a lot about Africa in many of the episodes, but with guests in the continent in sub-Saharan Africa, we did not do an episode. And so those are things we can now do because we have time to be able to reach out and plan an episode like that. So those are among the things that I think about in the time that we go forward from here.
Yes. No.
So let me turn the question to you, Sree. Can you reflect on, you've been reflecting, but on some of the most memorable shows and why?
Yeah, I mean, I'm kind of ashamed that there were so many episodes that were so meaningful to me, but because we've done so many, too many almost, that I didn't get a chance to make those connections, didn't get a chance to reflect, to slow down, just think about, oh my God, what did this doctor or this frontline worker, what did they have to say? We had an incredible episode with a nurse who finished her whole shift, came on and just talked with us. It was an amazing moment, but next we moved on to something else. Or the day we had a doctor in Italy join us. We did this episode about Italy. It was beautiful, so meaningful. And we had this doctor come and talk to us. She had just come from the ER. And this is when Italy was having its worst time. Now they're having it again.
That was the first weeks we did that.
Yeah, first weeks. And we learned so much in that. And then one other note that I will say that I feel bad is that we, for our convenience and because we're all working on other things, this is not our main job, we moved to the 9 p.m. slot. And so we lost Europe basically through all our episodes. And there was, when we had started, we were doing them more in the daytime. And so we had a lot of Europe episodes, a lot of European viewers, European guests. And, for all the talk of this being a virus from China and everything, we know that America got, especially New York, got its virus, the cases came from Europe. And that's why we felt a real connection there. I'll also say that I'm very proud of New York, how it recovered from the worst days. You remember how dark those were. And then in horror, we watched the rest of the country become like New York or worse than New York. And when we started, we were talking about the peak. And now to imagine that we're now higher than that, I just cannot fathom how that's
close to 200,000 cases, a day will be there.
Yeah,
so.
I mean, how is that possible for anybody to even think that we would be there? I'm so grateful to our partnership with Scroll. We had some memorable guests who were able to join us. But as I'm saying, I'm kind of ashamed that I can't remember everything because we did so many. You pointed out, Rose, that if this was a podcast, like most people know, podcasts are now so hot. They usually do one podcast a week and they plan it properly and execute it and do research and promote it. We didn't have time for any of that.
So like I said, it's, if we did 50 shows, we did 5 years worth of shows.
Exactly. 5 years worth of shows.
My dad was asking me, he said, I'm sure this is some sort of record. Like, do you want to check up on it?
Yeah, I don't know where we'd look, but it was just incredible. We had Charles Cunnincarroll with us, the inventor in you, the book about that. We had the mayor of a small town in Pennsylvania who was also an incredible AIDS activist who said that Fauci handled the AIDS crisis less than perfectly and that he learned from that. And that was good. So, these kinds of episodes, like you can't even imagine that we were able to pull all of that. We did a fun episode about matchmaking, the Indian matchmaking Netflix episode, because along the way we decided we're going to cover what it's like to live in the pandemic, right? It's not just about healthcare every day. We're going to talk about all kinds of things. Brand trust with Edelman. We talked about Portland in crisis.
We talked about forest fires in California.
Yeah, all of those things. And what about that young lady who tried to get Trader Joe's to change their racist?
Yeah.
I think there's now backsliding on that. I think now it sounded like they were going to commit to it.
She doesn't think they're really, keeping to their promise to her. And
yeah, we had a young man from London who was stopped by the police and falsely arrested because of the way he dressed. And then he went to do a TV show about this, and on his way home was again stopped and his car window broken and arrested. Like you cannot make up all of this stuff. And this was in the heart of the Black Lives matter awareness. We had Michelle Goodwin. Talk about her, please. She was amazing.
Michelle Goodwin is one of the women I've profiled for My Woman to Follow, and she's the law professor at University of California, Irvine. And she just wrote, she's written many books, but this one that she wrote about was about how many children, the birth, how many children are really not there. Black mothers don't get to keep and have authority over their children.
Wow.
And she's now, and her book came out just as I think it was March 12th, that book was coming out. And I had just done my profile, so right in the middle of the pandemic. And she now runs a great podcast for Ms. Magazine called In Her Voice. And she gets great people. I've heard great civil rights leaders, and just it's a great listen. So.
And then I will never forget, we had 2 episodes with Sapphire, the amazing author whose book Push became the Oscar-winning movie Precious, and she was on episode 264 and something like 241. And
64, she was like in the beginning, 64, and then 64, and then that's right, 240. Sorry.
Yeah, and she was great. So many people. It's just hard to remember them all. And I remember having Bill Ritter come on episode 20, episode 30. He's the amazing New York-based TV television news anchor, and he was recovering from COVID when he came on the air and talked to us at length about what he learned. And it was, I think, the first time I'd met a COVID survivor. And we had him on the air for that.
We had a politician who is now Zoran Mamdani, who is now the first South Asian man to be elected to New York State Assembly. We had him on before he won his race.
He was so great. We talked about the 40th anniversary of CNN with our friend Easton Jordan and Lisa Napoli. Who were there. Jordan was there at the beginning. It was so interesting. We talked about the power of newsletters with the head of National Geographic's newsletter business, and he was great, David Beard. We talked so many things. It's just hard to even imagine we pulled that all together. U.S. immigration issues. We did
the night before the election. Sorry, you go ahead.
No.
Yeah,
please.
Even the night Kamala Harris was announced.
The attorney from Washington who's advised Republicans and Democrats. And
Robert Barnett, he was amazing. Oh my God, he was great.
You could see how he's such a good debater, I thought, because if he
Rose, what was the comment he made to you when we were prepping him doing tech prep?
Oh yes, yeah. He said, I hate to drop names, but Hillary's on the phone.
And it was Hillary Clinton.
Yeah, exactly.
Just in case there was any doubt.
Exactly. I'm just looking. I'm sorry. There are so many comments here. And Jonathan says the content hole in a daily show is bottomless. And by the way, I want to pay tribute to Jonathan, who's been on our show multiple times as a guest host with terrific guests and friends that he brought. But also he watched 250 days in a row, and he deserves a gold star, a gold something for his patience and for watching. And he had a front row seat to some of the demonstrations, some of the looting, all of that, the fighting with the police, all from his East Village window. And it was great. Mark says, I have a Nigerian activist for you, Sree. He does a podcast called Mind Closet. Please write to us, also South African musicians. Thank you. This is awesome. Doug Levy says the Italy episode was super informative. And Doug was also on an episode about what's happening in California. And then Mark says, don't forget the spinoffs like She's on Call and Spin It Social. And I would even argue ally shows like Brian Schulman's and Tim Soane's and mine. Thank you so much, Mark. You're an amazing guy. And She's on Call was named by the Katz Horowitz family. And that's a show that these two producers worked on this morning, where they had two doctors talking about their gut, or all of our guts. two gastroenterologists with our friends, Dr. Sujana Chandrasekhar and Marina Kurian. Thank you for bringing that up. I'm not sure who's writing this, but all of you did an incredible job, amazing show. I'm telling my European friends about your show. Thank you. And now occasionally we'll do more in the daytime. So that'll be great. You had Dana Bentz of Streamyard on your program. You had Walter Greasid. So many people, the women activists. And don't forget the Native American story and the story you did on polling with Charles Franklin. Wow, what a memory he has. And don't forget about your excellent students who hosted and produced. That's right. We had about a dozen shows hosted by our students, and Vandana learned a lot.
More than a dozen. Yeah, a special shout out to the Stony Brook students who came on, and I think definitely gave me a fresh perspective on how to produce a show.
Work with students. Yep, it was really, really great, and I'm so grateful to everybody who put all of their work and support into the show, shared it, tweeted it. Just an incredible amount of work went into all of this. So we should start wrapping up. It's another long day, but I want to give Rose and Vandana a chance to.
No, I have a last question for you, Sree. What are you going to do at 9 p.m. every night?
Well, my family is excited to have me back because
I can imagine.
Yeah, they were just like, oh my God, is this over? Are you finally? They didn't want it to be over because they understand the value of it and what we've all done together, all of us. But they certainly are grateful to all of us, for all of you for working with me and helping me in pull this together. It was really a joint effort. My name's on the show, but as always, it's the people behind the stage who are doing the work. Here are some of our stats. You'll see that somehow October didn't get counted for some reason, but we still had 21 million people saw the hashtag #SreeCovid19 call, which I will always insist is the worst hashtag of all time. But it had 161 million timeline deliveries, more than 6,000 tweets, and these are the buzzwords that had the most, the word cloud. And now you're about to see the power of Rose and what she was able to do in tweeting. She had more than 3,000, she had almost 3,000 mentions, and she had almost 900 tweets. And if you add the 30 days that were not counted, that's almost 1,000 tweets. And then look at Stefan, just ahead of me in the number of tweets. So thank you, Stefan, for your tweets as well. And then the most reach, Shabana Azmi, who's a big Indian actress, retweeted one of our tweets, and Vikas Khanna, the chef who fed 20 to 30 million people. We had him on when he had just crossed 1 million people. And then he came back on August 15th, India's Independence Day, to talk more with us. And he was great. Nick Kristoff, who was on our show, 2 million, thanks to Lori White, 2 million followers. And then you can see all of these numbers here. So Rose, did you realize you've done 1,000 tweets?
No, I asked you today. You knew how many? I was curious.
Yeah, there you go. And these were the mentions, but we should go down and look at, let's hide that list and look at the most tweets. And 892 with Stefan second and Vandana just behind me at 276. And all of these other folks who tweeted, like anybody who tweeted, 30 times. Daryl tweeted 30 times. Diana 33 times. Therese 35 times. Amber Coleman Mortley, who was amazing. She came on our Gender Avenger show. She brought her 3 daughters on, and we had a fantastic conversation about talking about race. It was just magical to have her with us, and she was great. So all of these things are just amazing. Stefan says, Sree, you've inspired us all, and the Spin It Social Hour are being highlighted on the StreamYard Spotlight this Thursday, November 19th. So awesome for that. And let's not forget Bob Anthony, who says New York had the first November tornado warning since 1986 on the same night your streak of daily shows ended. Coincidence? I don't think so. Bob joined me to join me and Vandana to do a series called News You Missed. We did about 5 of them in the 250 days. And it was to just cover other things apart from COVID, because there was so much news going on. It was just so much work that we weren't able to cover. And so that format allowed us to have Vandana doing international stories, Bob doing domestic and tech, and all of it blending together. I thought that worked really well. Rose joining us to be co-host whenever she had one of her great gets that she was able to bring on. I thought all of that worked really well. And then another spin-off show from this is the weekly show called Coping with COVID, a helpful, hopeful call-in show. And our very first episode, our very first guests were Bob Anthony and Marina Kurian, Dr. Marina Kurian. So all of this came out of this one show, and I'm so proud of the work that the three of us have done, and so grateful to everybody who's watched. I know that for us, it'll be odd not to do a show every day, but the audience, they'll notice when it comes on going forward. But we're just so grateful to everybody who's here so many days. And here we are. We did another 2-hour episode. So let's wind up here. Vandana, I give you a final word, and then Rose a final word.
Yeah, I can't believe we've been doing this for 9 months. It's been incredible, and I don't know what we're going to do not talking and being in touch every single day. That seems a bit strange to be in the middle of a pandemic.
We may still be in touch every day because we'll be planning, right? But we won't be I won't be saying, have you booked somebody yet, Rose? Have you gotten somebody yet? Vandana, have you made the StreamYard link? All of that we won't be doing. But thank you, Vandana. You were amazing. And I'm just so grateful to you and your friendship through these days. So Rose, let's go to you.
I guess I'm thankful for having, for maybe creating a platform that people during this time of uncertainty were able to look for something that was certain and was going to be on every day, and something that we all put our, heart and soul into to make as best as we could, to make it the best we could and get the most diverse voices and, explore a lot of different topics. And that freedom was great. I think that we were able to, because it's just created by 3 people and run by 3 people, we were able to do what, we thought needed to be heard. And we had great feedback from so many around the world of what they thought. And we were led by that as well.
Yeah, and that's certainly been part of this. Mark says Roberta Oster was another great guest. She really was, and did a great job with us on an episode where we talked about so many different things, and also her boss from the Virginia Interfaith Public Society. We had Public Center. We also had the co-founder of Zipcar on an early episode, and here's a woman who's obviously had a lot of success in her life. She and her 2 adult children and her husband and I think a dog were all in a 1-bedroom apartment. And we talked about that, but also conscious of all the pain so many people are going through and all the different circumstances that people have had to endure. And it was really amazing. So I thought, if it's okay with both of you, we would do one more reading of the Say Their Names I think it would be appropriate for tonight. And let's do that if that's okay. And so we will go with the I want to thank Rahajan for putting together a more elaborate list that we were able to read over time. He went back to the 1930s and put together an incredible list. Today, we'll keep it simple and go with this list from Time Magazine, and the cover of Time Magazine of Titus Kaffer's painting of a mother whose child has been taken away, and you see the blue glove of the pandemic, and on the right, a photo I will never forget of Larcinia Floyd with George Floyd on an undated photo. She would die 2 years almost to the day that he would be murdered on camera in Minneapolis, and they're both now buried together in Houston. And with that, we are going to read and say their names. And the reason we're doing that is that we asked Kimberly Crenshaw on my radio show, what should we do to support Black folks? And she said, say their names. And so that's what we're going to do now. I'm going to ask Rose to get us started, please.
Okay. Trayvon Martin, Yvette Smith, Eric Garner, Michael Brown, Laquan McDonald,
Tanisha Anderson, Akai Gurley, Damir Rice, Jerame Reed, Natasha McKenna, Eric Harris, Walter Scott.
Freddie Gray, William Chapman, Sandra Bland, Darius Stewart, Samuel DuBose, Janet Wilson, and Kaylin Rockmore.
Alton Sterling, Philando Castile, Joseph Mann, Terrence Kutcher, Chad Robertson, Jordan Edwards.
Aaron Bailey, Stefan Clark, Danny Ray Thomas, Antoine Rose, Botham Jean, Tatiana Jefferson.
Michael Dean, Ahmaud Arbery, Breonna Taylor, and George Floyd. The amazing thing about this list is that some of these names are household names, and you know as soon as you hear Freddie Gray or Tamir Rice, you can picture the story. And then the amazing thing is that so many of these others are names you've never heard of, and that's what's so sad. Thank you for reading the names with us, and thank you to Rose and Vandana for doing this. We did this so many days this summer, and it was so meaningful as we got to do it. The other thing I'll say is that these are not even all the names. These are not even all the names after George Floyd was killed, and that's part of the pity of all of this, and it's so sad. I love how Mark is still pointing out great guests. We had Apollo, the great guest from Las Vegas, who was with us with Terry Thompson.
Who's now in New Jersey.
Now in New Jersey, and Damon Brown was the activist, who was terrific and joined us, and Apollo was the guy from Vegas. So maybe we'll let Linda's words be the last of this for this show. Thank you for 250 episodes. Linda Bernstein, great friend of ours, whose work on the social media weekend was part of the start of all of this and showing that we can do all this together, and brought us all together. Thank you, Rose. Thank you, Vandana. I don't have much else to say. I am so grateful. The way I said about Vandana, I also want to say about Rose. Rose, thank you for your friendship. Thank you for the incredible work you've done with this show. Thank you for Women to Follow, hashtag Women to Follow. I started this year, as you may remember, by only new following women and only retweeting women for 24 hours. I stretched that out to multiple days and learned so much. And I encourage everybody to check out Rose Horowitz on Twitter and then look for the hashtag Women to Follow. Incredible. We need to expand the voices we put on shows like this and in our everyday reporting, in our stories. Women, of course, women of color, people of different backgrounds, and Rose has put together an incredible list. And check out @HeyKiddo. Our friend Stacey Kratz has a Twitter list that you can follow of the women that Rose has put together.
100 now, I think.
How many?
1,800 right now.
Wow, 1,800. That's great. Whenever someone tells you, "Oh, it was a national security topic and we couldn't find any women," there are women there. Any topic you can find women, and it's.
Yes, I would just say, well, I don't have to go like reading a dozen articles. They're in my Twitter list. And I was, there's a Latin American expert there. So, so anyway, it's very useful.
Yeah. Well, thank you so much. And Linda again says, thank you for thinking up this whole COVID call. And Jonathan says, Apollo will catch up later, which he always says he does. Thank you to both of you. I owe you a lifetime debt for your journey with me on this. I am so grateful. I want to show you this quote from Hamilton. We did a great episode on Hamilton.
Oh, well, looks like she's having some technical difficulties. But what are the odds? The gods would put us all in one spot, popping a squad on conventional wisdom, like it or not. I love that.
Yeah, that's
well,
great.
Rose, it's been such a pleasure. I've learned so much, both from you and from Sree. And yes, you will still be getting texts from me, most probably.
Yeah. No, it's really great to have. I feel like I know you, even though we haven't met. We've talked about
every time Sree reminds us that we've never physically met. I can't think of any other time when this would have been possible. Yeah, And on that note, I'm gonna.
Yes.
It's been
Good night,
250
everyone.
episodes.
Thank you.
Thank you, everyone.